I have to tell you something. It's a normal and good thing to be excited about how your profession can help people. This is particularly so as a new graduate. You're full of possibilities and excited at the potential. This is how it should be. And I hope you can stay this way throughout your career because there is so much good to be done. But no matter how skilled you are, no matter what research you find to validate the principles of your practice, there will always be limitations, things you won't be able to do. Sometimes this is because you don't yet have the skills. And always know that there is potential to improve. But there will be things that you cannot undo, you cannot fix. And this is not your fault. This is the limitations of the body. We see this most often in disease and the disease process. Though the exact cause of many diseases are not completely understood, one thing is almost always present: permanent and irreplaceable destruction of tissue and the cells that comprise that tissue. With that destruction, there is an equivalent loss of function. The human body is incredible at operating at a loss, what we call compensation. And you can actually do a fair amount of damage to a tissue, certain organs, before you even notice impaired function. For instance, you could damage a substantial amount of your liver without noticing it. You could have a small amount of lung damage without drastically affecting your oxygen saturation. But there is a point at which the loss of tissue, the loss of cells, leaves the organ incapable of doing its job. We call this disease. Mobilization of the spine will not regenerate something that's not there anymore. Fascial release works to assist the existing structure that it supports. You can't crack the neck well enough to undo the scar tissue that replaces cardiac muscle after a heart attack. That's probably not the most motivating sentiment. But at the same time, it hardly means you should give up. Far from it. The opposite, in fact. What you can do is help the person you are working with achieve their best, their maximum level of health despite their injuries, despite the pain, despite the scar tissue. And even if it has limits on it, even though you can't make them 20 years old again, it's still better than what they would be capable of without help. Your job is to support the supporting structures like fascia by calming the nervous system, by making fluid movement better. Even if you still have part of the tissue left, it can work better. It can work harder. As well, though there are limits, if one of those limits is that the patient will require the help of others outside themselves for a while, even if it's for the rest of their life, that's not the worst thing in the world. Some would even call that a community. But maybe try not to make it too expensive. Just a suggestion.